I'm Ryoya Kawata from Nagoya State University, Japan. I am here to discuss about the time series expression of fibrosis-related genes in the bladder following pelvic nerve injury in an experiment using rats. Overflow urinary incontinence, OUI, often occurs with nerve injury during pelvic surgery for conditions such as uterine and colon cancers. Most cases of postoperative OUI improve with conservative treatment, including lifestyle modifications. However, some cases need invasive treatment and impair patients' QOL. Hence, a novel treatment for postoperative OUI is desired. In our previous study, we had reported the development of a novel neurogenic OUI model using rats. The left photograph shows us implementing a lower abdominal incision on rats. If you look to the right, you will see the major pelvic ganglion, MPG, in an enhanced image. Among nerves extending from MPG, we focused our attention on a branch called the accessory nerve, ACN. Based on our previous studies, impairment of the ACN caused symptoms of OUI in rats. In this study, we aimed to elucidate the pathology of OUI following ACN injury, focusing on bladder histology. Our study involved two protocols. In the first protocol, we evaluated bladder histology at 3 days and 4 weeks following ACN injury. You can see in this slide an overview showing the study protocol. 10-week-old male Wistar ST rats were randomly categorized into sham and bilateral ACN injury BAI groups. In the BAI groups, we crushed the ACN on both sides for 1 minute using reverse action tweezers. We set the observation period of 3 days and 4 weeks after operation. In all groups, after the observation period, we evaluated bladder function and observed bladder histology. The results of the cystometrogram are shown here in this slide. The top row shows the intravesical pressure and the bottom row shows the micturition volume. You can see in the sham group that normal voiding patterns were observed. In the BAI 3 days group, intravesical pressure was kept high and gradual dripping of urine was observed, suggesting the commencement of OUI symptoms. In the BAI 4 weeks group, you can start to see some changes. Voiding peak was observed. However, inter-contraction intervals were prolonged compared with the sham group, suggesting bladder underactivity. Here are the results of analysis performed on the cystometrogram 4 weeks post-operatively. Inter-contraction intervals in the BAI group tended to be more prolonged than that in the sham group. Maximum intravesical pressure in the BAI group also tended to be lower than that in the sham group. This next slide shows the results of Masson's trichrome staining. The left photographs are thin sections of the bladder body cut for the sham, BAI 3 days, and BAI 4 weeks groups. The right photographs are magnifications of the areas in small squares. As you can see, in the BAI 3 days and BAI 4 weeks groups, subserious fibrosis were observed. The results of image analysis are shown in the graphs on the right. The collagen area to total area ratio at both 3 days and 4 weeks following the procedure were higher in the BAI groups than those in the sham groups. Subsequently, in the second protocol, we evaluated the time series expression of fibrosis-related genes in the bladder within 3 days following ACN injury. The sham and BAI groups were created in the same way. An observation period was set at 4, 8, 12, 24, and 72 hours following the respective procedures. In all groups, after the observation period, we evaluated bladder weight and messenger RNA expression levels. This slide shows the results of body weight and bladder weight. There were no differences in the body weight between sham and BAI groups in all observation period. However, bladder weight and bladder weight per body weight ratio in the BAI groups were increased compared with those in the sham groups in all instances where they were observed. This slide shows the results of real-time PCR. MCP1 was significantly increased 4 hours after nerve injury and then decreased gradually. On the other hand, TGF-beta1 was significantly lost after MCP1's peak, but was then sustained at high levels. What do the results tell us so far? Pelvic nerve injury appears to cause OUI in the acute phase. In the chronic phase, OUI is improved, but bladder underactivity remains to occur. This underactivity appears to be due to bladder fibrosis. The bladder fibrosis begins in the acute phase and is likely to continue until the chronic phase. Moreover, OUI symptoms and upregulation of fibrosis-related genes followed by pelvic nerve injury might precipitate bladder fibrosis in the acute phase. Consequently, early intervention for preventing bladder fibrosis may be needed to hinder progression of OUI. Thank you all for listening.